All right, everybody, this is Dr. Shea from Align Life Chiropractic and Wellness. Today, we are doing episode 3 of the 5 pillars of chronic disease. Today is a major topic. Our second pillar of chronic disease is chronic inflammation. Inflammation is a huge topic in the media. It is one of the number one causes of heart disease, the number one causes of stroke. Remember, guys, heart disease is the number one cause of death in the United States for men, for women, for people of any racial background. This is a major, major consideration. In fact, one person every 32 seconds in the United States passes away because of heart disease. So by the time you're done watching this video, unfortunately, there will have been a handful of people that will have passed away because of this condition. So this information is so powerful because it's going to help you to really be able to change the way you do things on a daily basis to move you away from that concern. So let's talk about inflammation. So there's 2 types. There is acute inflammation. That is one that happens when you have maybe a new injury or you're exposed to a new infection or a new type of toxin, and the body goes out and attempts to wall off the area. It's going to use some white blood cells. It's going to send a lot of blood flow to the area to try to begin the healing process around that new injury. That being said, for today, we're really not discussing that type of inflammation. What we're going to talk about is chronic or long-term inflammation. Again, we've talked about acute stresses for the body are ones that we can typically manage well, but the human body is not very well suited to handle long-term or chronic problems, and especially in this case, inflammation. So what am I really describing? So inflammation can be caused in the body chronically because of a poor diet. It can be caused because we have excessive movement, meaning we're exercising rigorously for a very long period of time without any rest days or any self-care or recovery procedures. And it can be caused because we have exposure to lots of toxins, drugs, alcohol, long-term medication use. All of these things within the body have the potential to lead to long-term chronic inflammation. So what do we feel like when we have chronic inflammation? Guys, we're puffy, we're swollen, we feel like a loss of energy, we have an increase in our pain levels. All of these types of feelings because our body is really going out chronically all the time, using lots of energy to be able to knock down all of the different problems that we're sending to the body. Now, keep in mind, we've talked about the importance of having your body live at a homeostasis level, a balanced level. If you keep lobbing problems at the body, then it will chronically have to go out and handle these, which ultimately leads that you're going to be inflamed most of the time. So what can you do if you want to eliminate the likelihood that you have chronic inflammation? Well, guys, remember, it comes back down to eat, move, think, and your structure. And I would also add in there sleep. Number 1, if you want to get rid of inflammation, try to take some naps, get some long-term rest. That's going to be a big thing because that's your body's opportunity to heal. Finally, growth hormone is secreted during that time period. Everything drops down from a hormone level into a really healthy place during sleep. So that's number 1. Number 2, look at your diet. What are the things that you're putting in your body? Can you eliminate chronic use of alcohol consumption or cigarettes or drugs or medication? And also, are you eating a lot of processed foods? Refined sugars, things that come in a package or a can or that are found in a box in the grocery store. Take a look at gluten, take a look at dairy. These are ones that are extremely common to lead to chronic levels of inflammation. I would also have you think about movement, full body movement for trying to flush inflammation out of our tissues. Remember, your body when you're exercising is contracting and then relaxing muscles, which creates a pumping mechanism to be able to push fluids throughout the body. This also impacts your inflammation load. So if you go out and you move your body in a safe way, good form and technique, then that's going to help to knock down inflammation in your system. I would also recommend the idea of supplementation. So a good fish oil supplement or maybe a turmeric supplement. These are great things to add. Adding things, especially in the beginning of trying to change your lifestyle, is a great way to get you some momentum because it's typically an easier thing to do than try to take something away. When you take something away from your lifestyle, it's considered oftentimes to be difficult. more hard or it uses willpower. When you add something, it's a lot easier. So if you want to get started with something immediately, I would say go ahead and start supplementing. I would also suggest the idea of thinking positive thoughts. I don't know if you guys have ever felt this way, but sometimes after end of a stressful day, there's such a carryover between what's going on in my mind and how I feel in my physical body. If I feel kind of swollen and stiff and tight and sore, often it's because I've just had a lot of tumultuous thoughts as I've gone throughout the day. Last recommendation, guys, chiropractic adjustments are fantastic at being able to alleviate inflammation in your joints. If we can get inflammation out of your joints, your body starts to move better. You have the ability to have a greater range of motion. Your flexibility comes back. The energy starts coming back into the body. And now you have the opportunity to get out and move more, which then starts that momentum cycle moving you in the right direction. So take those action steps. Think about what you're doing from an eat, move, think, structure, and sleep perspective, and eliminate the idea of chronic inflammation in your body. Guys, I look forward to hearing from you on how you're doing with this, and we'll see you next week for episode number 4. Take care. Have a great week.